Hi, I'm Ashley Ernest with NKCDC. I'm a community health worker, and we're here today to talk about COVID and the effects in our neighborhood. Welcome. Thank you for being here.
And I'm here to tell you who is who that is in the room. We have from the expertise panelists Felicia Davis, a social worker, Guy D. Lewis, Director of Nursing Services, Caiseen Martin, mental health worker, and two parents sit on our panel list for guests, beginning with Kim Rollins, who is a parent and also a transformational coach, and Janine Waters, one of our very own at NKCDC, community health worker. Now I turn it over to Aaliyah.
Good evening, everyone. I'm Aaliyah Miller. I'm a CHW with New Kensington CDC. This evening, I will be interviewing our expertise panelists along with our parents. Hello, Miss Felicia Davis. How are you this evening?
I'm good. How are you?
I'm pretty good. My question for you is, as a social worker, how has things changed for you since this pandemic has started?
As a social worker, I'm really used to doing everything hands-on. You are dealing with people and their trauma, their emotions, they're carrying the weight of the world. Sometimes people need a hug, so not being able to physically go out to the homes and having to meet virtually has had a huge impact on our families and working with our families, because having that person there to kind of hold a hand and to comfort them and to even provide those in-person resources, it's been different and it's been difficult. And I'm a person who likes that part of my job. So I think, as much as we've all tried to sort of look at the positive, I think it's really been it's been hard, and it's taken a toll on our families and what they've been used to and regarding the connection with their social worker.
Have you seen any changes with your clients since meeting virtually?
Yes, especially for the clients that have been newer to my caseload. This has been our initial introduction. So this is sort of like our normal. But for the clients I worked with prior to the pandemic, it's been tough for them because they're used to me being in their home and working with them and also working with their children. So that part, to be honest, they've been a little sad, because you essentially become a part of their family. You're their person. So when their person can't come to meet them, there's like a void there. So I think that has been difficult on the client part.
And if you had any advice to give anyone during the pandemic, what would it be?
I would say really forgive yourself we are sitting in front of a computer all day. Our kids are sitting in front of a computer all day. I'm a full-time social worker and a full-time mom. So trying to balance all of that at one time is really hard, but it's really important to be able to reflect on the day. I started looking at things where it's like, all right, well, we got through the day. Every day may not be that way. So I think it's really important to just find maybe at least 3 things that were good in the course of the day. Maybe your kid didn't get up, at the time you wanted them to get up, but were they present for class? Maybe you didn't finish that report in time because you were helping, your child try to prepare for this test or whatever it might be, or maybe they had a breakdown in the middle of the day, or maybe you did, but really giving yourself grace and just knowing that we really are all experiencing maybe not the same exact story, but we're all struggling in different ways, and just allowing yourself to just have bad days and also taking care of yourself in the midst of all of that to make sure, to make sure you're taking care of yourself, taking care of your heart, taking care of your mental health in order to be able to, if you're a parent, to be able to parent your children effectively and also do your job effectively, because it's much harder than it's ever been before. And we're all imperfect. So we have to forgive ourselves for that and be able to just, take it really day by day.
Thank you, Miss Felicia Davis,
Sure.
so much for your time.
Thank you.
Mr. Guy D. Lewis, How are you doing this evening?
I'm fine, thanks for asking. How are you and the rest of the group?
I'm maintaining. Thanks for asking. With you being the director of nursing services, have you had any personal experiences with COVID-19, knowing anyone that had it or passed away from it, or that it affected worse than someone else?
Absolutely. In my facility, we've had several employees as well as residents that have been infected with COVID-19. 2 deaths to date. We've even had staff members who are asymptomatic, yet they tested positive for COVID-19. And we've had people who are testing positive and were symptomatic. And I'm here to tell you that I've had a long history in healthcare. Years as an emergency medical technician, 30 plus years as a registered nurse in a big healthcare system such as Temple. I've never seen a disease spread this quickly, have this many confirmed cases, and this number of deaths in such a short period of time. So yes, I have seen it up close and personal, and we need to take mitigating steps to curb it.
And while a lot of people think that it's not real or that it's a hoax or they just don't believe in wearing masks, with you being directly there and seeing firsthand asymptomatic people and people that have symptoms, what advice would you give to them?
I can understand people having skepticism about wearing masks because they hear it from politicians. Masks have become a political issue as opposed to a healthcare issue. I would ask them just to look at the statistics. We every morning at Report, we have a report on COVID-19. We see the number of confirmed cases in America, the number of confirmed cases starting in Philadelphia, the state of Pennsylvania, America, and globally, because that's what a pandemic is when you have a disease that's worldwide. The statistics are astronomical. Worldwide, there's like 61 million people infected with this disease. The confirmed number of cases here in Philadelphia is like 19,000 plus. The number of deaths are in the thousands. Every day, the numbers increased. So if people are skeptical about it, they must have their heads buried in the sand somewhere because this thing is real. And a mask is the simplest thing we can do. We've been waiting on a vaccine for years. Well, not years, but it seems like years because the coronavirus is a member of the corona family, just like SARS and MERS, the Middle Eastern Respiratory Syndrome. They're all in the same family. We've never had to have our society wear masks today at any other time in our history. So if you don't think masks protect us, try being at a super spreader event where people are unmasked like we see in the political world, and then you see the number of cases increasing after that event. That would tell us all that masks are effective and we need to wear them, in addition to hand washing, in addition to wiping down commonly touched surfaces. Those things work until we acquire immunity.
All right, Mr. Lewis, thank you so much for your time and your advice for us all. I'm going to go on to our parent panelists. Okay, we'll start with Ms. Janine Waters, NKCDC's very own CHW. How are you doing this evening?
I'm doing all right. Thank you for asking.
With you being a parent of 3 little ones and working from home, what changes have you seen within yourself and your children dealing with COVID-19?
Well, working from home, I noticed that my children have been a little sad and very confused. They at first didn't know what was going on. They was afraid. So I had to pretty much talk to them and comfort them and let them know that things will come along and it will be better for them and for myself. I noticed that I couldn't go out. We couldn't really go outside. I was afraid to take them anywhere because of what's going on out here. I would say work. I had to stop working, at a previous job because of what's going on. And it pretty much stopped a lot of things that we normally do on a daily basis. And we had to pretty much be at a standstill in our own home. So, yeah.
With your children being at home all the time versus them being able to go out to the park and go to school, what other ways have you created fun for them?
Okay, so I've got I got some board games for them. I have Connect Four, which is a old game that I used to play when I was younger. I have bought a what is that? It was one of those games I had. It was another game that I had purchased for them. We try to do like movie nights to make it a little fun and interesting. I'll have them like read some books in the house, play some story, have a little story time. For the most part, and even when it just snowed recently, I allowed them to go outside and play in the snow since we really couldn't go anywhere. We still do take little walks to the store, and they actually enjoy those walks. So those are like some of the things that we do to keep their mind going and keep them, a little happier about things, and just to keep it off of COVID-19. They actually like to play the game, which is the famous game is right now Fortnite. So they enjoy that a lot. So, and it was one other game that I pretty much can't think of right now, but the Adopt Me, stuff like that. That's another game that the kids play, and that pretty much keep them, keep them busy, keep them from being afraid.
Okay, and so what have you been doing to deal with self-care and being a mother and everything that's been going on?
So what I have done, I've been talking to my friends, talking to family, just trying to keep in touch with everybody since this had been happening. Self-care, I pretty much will probably exercise inside as opposed to outside. Pretty much movie nights with my kids. That's self-care for me, just to see them happy makes me happy. So, pretty much like hot baths and stuff. It just, just relax, something that just relaxes me, pray, pretty much pray. At the end of the night, that's what I have to do, just to stay sane, and nothing else will work without prayer, honestly. So I feel like they are the things that will help me in the end with just being a parent of 3 children.
Okay, and your children have been drawing artwork pertaining to what's going on. So have they just been having a good time expressing themselves via artwork, or do they do it verbally as well?
I say a little bit of both. They have expressed themselves through artwork, 90% of the time because they have to stay indoors. So specifically my daughter, she always does artwork to express herself. Yeah, so there were one of the art projects that she had done. Pretty much the world right there. That's a police officer and all the shootings. This picture is basically everything that's going on in a whole. It's COVID-19, is the police brutality, and the school closing. She has the school right there. The burning buildings. From people just setting stuff on fire. She watched the news, so she's seen it. Yeah, so this picture pretty much covers everything that's going on throughout the year. So
she's pretty expressive. That's very good artwork, better than mine.
Yeah, she's very artsy.
Is this another one of her drawings?
Yes, that's another one of her drawings. I believe the lady that's right here is supposed to be sick, I believe, with COVID-19. That's the doctor. And I guess she drew the picture of the heartbeat. And that's the family member. I guess you can have a family member, I don't know, in there. But this is a picture of, that's the doctor at the hospital, the patient, and they have COVID-19, they're sad. And she put cough right there by the mouth. So yeah, so that's how she feels. She hear it all. She's seen it everywhere on TV. Then she hear it from some of her friends. So she just draw it out.
Okay, that's great artwork. If you had to give any advice to any other mothers right now, what would it be?
Whatever you do, just be patient. Please stay calm, because even if you try to, go crazy, or it won't help anything. You would just have to really be patient and calm. Write down some hobbies maybe that you'll like to do. For the most part of being home, call your friends, reach out to family members over phone, or even, through social media. Write down some strategies for the kids, maybe things that they can do while you're indoors. We're going through all this singly, but it's still together. So we'll definitely get through it in time. But I'll just say, like, just try your best to stay calm, do something that you really like, because self-care is definitely needed in this kind of era that we're living in. So that's my advice to all the parents out there. And talk to your children. Talk to them and let your children express themselves. And that's most important, because children have feelings and they're going through a lot just like we are.
All right. Thank you, Janine Waters, for your advice, for sharing your artwork from your daughter with us.
You're welcome. Thank you for having me.
Next, we're going to have Antonia. She's also one of our CHWs here at New Kensington CDC. Hello, Antonia. How are you doing this evening?
I'm doing good.
That's good. So with the holidays being a natural stressor for a lot of people you are usually depressed. And now that it's the holidays and a pandemic, how have you and your family been adjusting?
Kind of doing the same thing as Janine, having lots of movie night. I do have to constantly explain to my son, my oldest one, that he can't go outside or go back to school just yet. He's still not understanding that concept. My youngest one, all day play. That's all he basically registers in his head. So we do a lot of playing. I do a lot of my artwork now. I talk to family that I haven't talked to in a while because I'm always busy. So it's just catching up on things I can't normally do when I'm always working.
I believe COVID has really brought a lot of families closer together, because normally we'll be at work all day and then come home. It'll like be a routine. Now the routine is broken. You're home all day and everybody's here. So now let's have these tough conversations that we would usually have time to avoid. Yes. Now you can't avoid it because it's right here in your face.
A lot of Zoom calls too.
Yes. How has your oldest son?
He thinks that, everything's okay, that we can still go out, he can still hang out with his friends and stuff, but he doesn't understand the whole thing of keeping your mask above your nose. He likes to have it like down here, and it doesn't work out like that. So he's a little difficult.
Okay, and this is some artwork we have from Miguel.
Yes.
Can you tell us a little bit about his drawings?
He basically thinks that COVID is a dirty pond. This is how he described COVID. It's a dirty pond and it doesn't go away. This one, actually, both of my kids did. My oldest drew it and he colored some with my youngest. This is how he thinks walking outside COVID looks like. And this one, he described it as COVID touching the planet. So it's a little creepy, I guess, virusy hand touching the planet and spread it all over.
Okay. And with you being an artist yourself, have you been more expressive doing your artwork with everything that's going on now? Do you feel like you have more time to do it?
I definitely do. I usually sketch out, don't ever get to paint it, but with COVID happening, I have a lot of time to paint now.
All right. Thank you so much, Antonia, for sharing your children's artwork with us and for telling us how you and your family has been coping with everything that's been going on in this pandemic.
No problem. Thank you.
All right. Hello, Mr. Caiseen Martin. He has joined us. How are you doing this evening?
I'm good. How are you?
I'm pretty good. With being a mental health worker, how has things changed for you, being as though you're essential and you're on a job?
Well, you know that you're not able to service in the homes that, unless the people of the home feel comfortable with you stopping by, but that's very few and far in between with everything that's going on. The consumers sometimes might deny services more so likely now, and a lot of people are out of work who are in my industry. And it's a struggle for us, just like it's a struggle for everyone else.
Have you, do you know anyone personally that has had COVID?
Yes, one of my family members just passed from COVID a couple days ago. It's my cousin's wife.
I'm sorry to hear that.
Thank
And
you, I appreciate it.
if you had any advice to give anyone about COVID-19, what would it be?
Just to stay safe, keep your mask on, follow all the protocols, and I think we'll all get through this now that the vaccine is here. You'll probably all, especially those working in public domains, will probably have to end up taking the vaccine.
Okay. And how do you feel about the vaccine?
I feel everybody has their opinion, but I feel it's definitely going to be a necessary tool for us to move forward as a people, to be able to go back to having things the way they were before COVID-19 came out into society. And everyone, at the end of the day, everyone has a choice. So I'm not saying people don't have a choice. People definitely have a choice. It is your choice if you decide whether you want to take it or not. But me personally, I probably will end up having to take it with working with people in the home and in facilities.
A lot of people that work in hospitals or directly with people are most likely going to have to take it to keep their jobs, because
Yes.
that's a requirement. How have you been coping with COVID-19?
Well, one thing that I do, I try to keep up on current times by watching the news, understanding the new updates and everything that's going on, but also trying not to watch the news all the time, because it will affect your mental condition if you constantly watch, all this death and people getting sick and the tragic stories that are taking place at this current point in time. So that's one thing I try to keep updated on what's going on, but also not to try to constantly watch it, because it will affect your psyche. It will affect your psyche, any human being. Because when you see people constantly dying, it's almost like, it's not war, but it's almost like being in a war, constantly watching people die and things like this. It can be very difficult for any human being to It can be very difficult for any human being to watch. But and also, you know, just trying to maintain, you know, those protocols and be safe as I possibly can, to know that I will never do anything to cause myself to contract the virus.
With the vaccine being now available, and it took a little under a year, do you feel like this vaccine is the same, will be like the flu vaccine in the medical facilities, whereas though you have to get the flu shot, you will have to get the COVID-19 vaccine, like you get the flu shot when you work in medical facilities?
Yes, I believe it will be that way. It's kind of already that way. One company that I work for, they're stating that every employee has to take the flu shot first off before we're even allowed to go back to work. And another company is basically trying to write up some documents to cause everyone to have to take the new vaccine that's coming out, because you're not going to be able to work around people or, you know, in a hospital, because I also work in a hospital too. So it'll probably become a state mandated type of thing in the future, you know, just to be safe, to keep from any other cases occurring or anybody else getting sick. And it's definitely necessary.
Okay. Thank you so much. I see your little bundle of joy. Thank you
Yes,
for
yes, yes. I had the camera, but you know, I was feeding
congratulations.
her and I
God
was
bless
feeding
her.
her and burping her. So
Okay.
that's why the camera was moving.
God bless
Oh,
her.
Yes. Okay,
thank
thank you. I appreciate you.
thank you for taking time out to speak with us today, this evening.
All right. Have a nice night.
You do the same.
All right.
Would any of our panelists like to add anything to the questions in which Aaliyah had presented here this evening? Guy?
Just one thing. The sister asked about the importance of mask and wearing a mask. Since this is a respiratory illness, it's spread through droplets, through coughs, sneezes, talking, close contact. Vaccine won't help you with that until you acquire immunity. So for right now, the mask is one of the most important things we can do to mitigate this spread of the coronavirus. Thank you.
Thank you, Guy. Felicia, is there anything else that you'd like to add?
I just would really just like to add how important it is to really take care of yourself. I've had some really tough days as a parent trying to be a really good social worker and a really good parent at the same time, and really learning how important it is to really redefine wherever our lives are at the time and what season we're in at the time. That's probably been the greatest lesson that I've learned, is really just I'm doing the best that I can, and so is everyone else. So really, like I was saying before, just really forgiving yourself and taking it day by day. And as the other parent was saying about just like taking baths and practicing self-care and doing all of those things for yourself, although you're home all day trying to get out, whether if it's a walk or whether if it's playing in the snow or just watching a movie, you know, wherever you find your joy, it's so important to just find a little slice of joy in each day, to really help us to keep going. Because although 2020 has been a really tough year, we really don't know what's ahead of us. So it's so important to just practice those positive things, to put yourself, you know, in the best space that you can be, and just try to strive to be the best version of yourself in your current season, and being okay with where you are in that season.
Thank you very much, Felicia. Ashley?
Hi. So we want to thank everyone for being here. Just to tell you a little bit about our organization, we serve the Kensington area. we work with the community at large. We work with housing development and crime reduction, and also some real estate development. We work with so many different things. As you know, we're all community health workers, so we're here for you. You can reach us at, if you have any questions, want to talk, at connectors at nkcdc.org. And you can also find us on the web at nkcdc.org. We do this once a month. We're excited that this is our first one as a cohort. And we'll be back next month with reentry and the justice system. That will be our topic for next month. So we hope you can join us then. Thank you so much.